Hi, I'm Sean Fit for Life. I am a strength and conditioning coach, and I help people move better and perform pain-free for the rest of their lives. I created the Cold Feet podcast because I wanted to have like-minded people here with me, interview them in the cold water as they push their mental limits. So grab a hot cocoa, stay warm, and enjoy the episode. What's up? Welcome to the Cold Feet podcast. Today I'm privileged to have on the show this Eastern doctor and acupuncturist. Can you go ahead and introduce yourself?
Hi, I'm Aaron Kenin. I'm a doctor of acupuncture and Chinese medicine, licensed acupuncturist in California, and a national diplomat in the United States. I've been in Israel for about a year and a half. And I have a clinic in Alon Shvut in Gush Etzion, and I practice 1 day a week in Jerusalem in the Givat Shul neighborhood.
Really cool. Thank you so much for coming onto the show. I want to share with my viewers out there that this is our second attempt at this episode. Dr. Aaron here, can I call you Dr. Aaron?
Sure.
Sweet. Sat in the ice bath for 90 minutes and none of it filmed. And you know, it was a big bummer, I think, for both of us. But I said the prayer, you know, God grant me the serenity, accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And the filming stopped, and you know, that's life. So it sucked for me, it sucked for Aaron. For like the first minute, I was like, okay, I'm not doing a podcast episode for the next while. But then next week, I'm like, hey, Ahuva, you were in my episode, you're a videographer. Could we make some sort of arrangement where you could film my podcast to ensure these things don't happen again? So it was a huge learning experience for me. So thank you for coming again. Really appreciate you. Ahuva, thank you for being out here.
Well, I get it that it was a bummer, but I enjoyed meeting you, and I enjoyed the conversation. It's too bad it didn't film, but for me, it wasn't wasted time.
And you got a 90-minute ice bath out of it, so hell yeah, right?
That's right.
So today we're going to delve into the Eastern medicine world, or the more holistic approach versus the Western medicine. So here we have this nice cold Dr. Muhaha next to me. Dr. Aaron, can you explain to us the difference between Eastern medicine and Western medicine? Specifically two things: the way they're trained and educated, and the way they treat patients.
Okay, so I'm trying to be as summarized as possible. Let me just say first, I practice traditional Chinese medicine. So under the rubric of Eastern medicine, there are other systems. I can't speak for those systems. For example, I don't know much about Ayurveda at all, which is a traditional system from India. And even with regard to Western medicine, there are different approaches. So whatever I say, take it with a grain of salt. There's more information out there. But basically, for the most part, Western medicine treats symptoms. And the attempt of Chinese medicine is to look at the body holistically and to see symptoms as part of a pattern and to treat the underlying causes of the pattern so that all of the symptoms will resolve if the pattern is addressed correctly. That's in a thumbnail. Specifically with regard to traditional Chinese medicine, there's a saying that kind of encapsulates it, and it goes like this. Translated to English, it's roughly same disease, different treatment, and different treatment or different disease, same treatment. So what does that look like? If two people come into a Chinese medicine doctor with a backache, if two people come into a Western doctor with a backache, for the most part, the Western doctor is going to offer exactly the same things. They may not even touch your back. They'll ask you some questions. Depending what they think, they might send you for an x-ray. In some cases, they might send you for an MRI. And they'll probably offer you a non-steroidal anti-inflammatory drug. And if that doesn't help, then they'll probably offer you potentially a cortisone injection, steroids. And they may offer you physical therapy. They might send you to an acupuncturist. I hope they do.
I hope so too.
But eventually, if those methods don't work, then they may offer you surgery. In Chinese medicine, what happens is somebody comes in with a backache, and I'm going to ask a lot of questions. I'm going to ask, where does it hurt? How long has it been going on? Do you remember hurting yourself in a specific way, or is this something that's gradual? Is it a sharp pain? Is it an aching pain? Does it hurt more after rest? Does it hurt more after movement? And then other questions that might seem to have nothing to do with it, like, do you have ringing ears, tinnitus or tinnitus, depending how you pronounce it? Do you have difficulty with urination, difficulty controlling the stream, or frequent urination, issues like that? A bunch of questions like that. And do you sweat at night? Are you cold at night? Things that you might think have nothing to do with the back pain. And depending on those questions, I see that as part of a pattern. Somebody else comes in with back pain, and that person has a red face and they're irritable. They just hurt their back. Never hurt before. They just hurt their back.
It wasn't chronic. It was like
right. They picked up the charcoal for a barbecue, and now their back hurts. The other guys, 20 years of back pain comes and goes. So that's two different people with the same disease, which is low back pain. But in one case, I'm treating something different, which is probably kidney qi deficiency. In the other case, it might be qi and blood stagnation. Now, somebody else might come in and say, my problem is difficulty controlling my urination. Doesn't sound anything like the back pain. And if that guy went to the Western doctor, they would be addressing the urinary issue. Maybe they would say that they have bladder sphincter dysphagia or something like that, and give them lifelong drugs to relax the bladder muscles. And what I would do is find out, oh, this guy also has back pain. That's not what he came in for, but he has back pain. He has ringing ears. It looks like the first patient. So I'm treating kidney qi deficiency again. And so that's different disease, same treatment. Whereas the first two back pain patients, that's same disease, low back pain. You can call it disease, condition, whatever you want, and different treatment. Because I'm treating, in one case, I'm treating kidney qi deficiency. In the other case, I'm treating qi stagnation, blood stasis.
Sounds like a very wholesome, well-rounded approach to helping people with their issues or symptoms. Would you say that all Western doctors or the whole Western medicine world works that way of just treating the symptom, or are there Western doctors out there that do use a more open-minded, wholesome approach that's not inherently Eastern?
Yeah, I mean, that's, without going into the philosophy behind Eastern medicine, it's difficult to answer that. The short answer to that, and also I'm speaking for Western doctors, I'm not a Western doctor, although I have some training. I would say Western medicine also ideally is attempting to look at the causes of things, but their concept of what the cause is much more mechanistic and much more specific. So that person with low back pain, they do an MRI and they say, you got a herniated disc between your L4 and L5 vertebra, you got stenosis of your lateral foramina, and it's putting pressure on your nerve root. That's causing some symptoms, and so we need to address that, either by doing a surgery or doing traction, taking pressure off of that vertebra and trying to get the nucleus pulposa to retract. So they're still trying to address the cause, not just the pain. But the vision of the cause is much more local, whereas in Chinese medicine, the vision of the cause is with regard to the whole body and also the spirit as well.
Wow. I mean, I'm not a doctor. I am a movement and health professional, though, and I've seen two things. One, I've seen many clients come in who suffer from pain. At the end of the day, as a movement and health professional, I work with athletes, and a lot of times they get injured, they pull their hamstrings, they pull their adductor, their lower back hurts, their shoulder hurts, their shoulder's tight. The first thing I do is I look at two things. How are they training? You know, what are the rigors of the training? Are they doing it perhaps wrong? Or maybe they're training correctly, but they're sitting slouched over a computer all day, or, you know, lack of hip mobility, or all those stuff can cause the pain. And the way we fix that is through mobility training, stability training, strength training in the joints. Now, if you were to go to a doctor, with a Western doctor, with the same symptoms, like my back hurts or my shoulder's tight, rest it, don't move for 3 months, put it in a sling, pop some cortisone shots. And like, I've been on the receiving end of this as a patient and seeing the Western world, and it upsets me because I know for a fact that movement is so important that most of the time, assuming that it's not something deeper, you know, if someone has major internal issues, movement won't inherently help him, movement will help him. And the doctors are always saying, immobilize, immobilize, put it in a cast, put it in a sling. Don't move, and it's frustrating because, you know, as a practitioner, I'm working in the Western world mostly, and I'm working at almost, a client comes to me and says, my doctor told me not to move. I said, well, now we're in my gym, so this is my clinic, and I'm going to override the samchut of the doctor because I understand what your body needs, and what your body actually needs now is, let's say, mobility and stability in that range of motion, whereas if you don't move, you're just going to keep on getting the injury again, and that frustrates me a lot.
Right. Well, what I would say about that is I'm seeing a change with regard to that. First, I want to say, just in terms of the thought, does it make sense to move something or does it make sense to rest something? Clearly, it depends on the specifics. But if you're going to think generally, how do you know if something's alive or dead? Most of the time, if it's not moving, it's dead or injured. If it's moving, it's alive. Even plants, if you do time-lapse photography, they move. They're growing.
Correct.
Right? And if you want to preserve something so that it doesn't rot and die, you make it cold. Right. And if you want something moving and healthy, you keep it warm. So it makes sense to me that warmth and movement in general are good for health. And cold, I'm sitting in cold water, but it depends on the specifics.
Correct.
Cold and immobilization are not good. And it depends. If you broke your arm, you might need to immobilize it, for sure.
Right.
But I'm seeing a change with that. I'm seeing Western medicine, at least in what I'm seeing, and mostly this is in California, which may be in a different place from Jerusalem. Instead of using plaster casts and fiberglass, I see that they're using boots that allow some mobility of the foot and ankle more than they used to.
Wow.
I'm seeing that people are being told to move when they can. So I do see more of a trend towards that. And also with regard to cold, the guy who invented the concept of rice.
You took it back, right?
And so that's starting to get out there. Rice, for people who don't know, is rest, ice, compression, elevation. That was made popular by a sports medicine doctor. Forgetting his name right now, but if you look it up and find his webpage, he says that's what I thought back then. More research has shown that not only is movement better than rest and heat better than cold, but actually even compression and even allowing things to swell may be better.
Right.
Which makes sense. How did it develop over time that the body swells when something's hurt?
Right.
Maybe that has something to do with the healing. At least it's worth considering.
For my humble, non-medical field educated mind, the way I understand it, like when it comes to inflammation and swelling, is that the inflammation and swelling is the body's natural response that God, or whatever you believe in, put into us to help us with the healing process. Right. So if I'm going to take external forces such as ice or such as heat or whatever it is to manipulate it, that may or may not be a good thing. Sometimes swelling and inflammation is the healing process. So if I take cold, for example, and slow down the inflammation process, I'm probably slowing down the healing. Now we are in an ice bath now, and I did a lot of research into cold exposure, so I do want to address that. My personal cold exposure, I keep as far away from my workouts as possible. Meaning I'm doing cold exposure, nothing to do, and I'm having people sit in the ice bath, nothing to do with, the recovery benefits. The only time I've seen any studies that show that it is beneficial, if you have a multiple day competition, like a 5-day CrossFit competition, or like Olympics where you're competing again and again for days. So it kind of like freezes your system, puts it in that state of like, okay, you won't feel your pain now, but after the week's over, major muscle damage. But the thing is, athletes aren't the epitome of healthy people. They want to win their gold medal and win their competition. I use a cold bath for like mental toughness, Wim Hof, whatever immunity it helped maybe developing us. Wow, it's good stuff. One more thing I wanted to add regarding the Western versus Eastern world is I've had a chronic eczema my whole life, and after coming to the doctor, I've had this since I was a baby, and after coming to the doctor, after years and years of it, she's like, oh, you're suffering, here's a cortisone shot. So I didn't know better, so I took the cortisone shot and I fainted. Took the cortisone shot and I fainted. Now, I like to think I'm a healthy human being. I don't know what, it was the first time I fainted in my life, by the way. It was at the age of 23 or something. I don't know what my body was thinking, but clearly whatever was in the cortisone shot, my body didn't react to it. Maybe because I'm healthy.
How long after you got the shot?
Immediately. I got the shot and like, I was a little bit like, and then I just dropped.
And have you ever had that reaction to other shots?
No. Although maybe I haven't had shots since then.
Well, I'll tell you why I asked you that. I haven't heard about that reaction to cortisone, but I was considering Western medicine when I was younger, and I used to volunteer on Friday nights at the Children's Hospital emergency room in Oakland. And they told us when we were, as interns, when we were learning about it, getting ready, they were training us, they said, look, if you ever feel like you're gonna faint, just sit down. I'm like, me, I'm not gonna faint. I never trip out on blood. Like my mom took out my own stitches when I was little. I learned to do that stuff. I don't have any problem with it. And one day I was sitting there, or standing there, watching some procedure. It wasn't even bloody. And all of a sudden, I got all lightheaded. And I remember what they said, and I sat down. And I didn't faint, but I almost fainted. And I don't know where it came from. But so, I wonder, was it the cortisone specifically, or just a reaction to seeing the shot?
Interesting. I mean, that goes into the physiology of fainting, what happens in your body. We'll delve into that in a future episode. And we can also delve into heat and cold exposure, different episode. Back to the eczema story. So after that cortisone shot, that among many other episodes of the Western world kind of made me start rethinking medicine in general. And instead of, going to this cream, to that cream, which I've been trying my whole life and it wasn't working, I began examining my personal journey. What causes my eczema and how can I fix it? So I noticed that when I was stressed, I was scratching more, I was picking more. Stimulus, the psychological. The doctor won't tell you that.
They do now.
West. Oh,
more,
wow.
There is more understanding of that now. Yeah.
Wow. Well, I didn't know that. That's I guess I wasn't exposed to that as a younger kid. And I experimented with 3 things which have helped me tremendously. Number 1, I started switching to only filtered water. I started switching to only natural shampoos. And once again, this is not based off medicine. This is based off my knowledge of the skin. Perhaps all the chemicals in shampoo and all the chemicals in water are causing skin damage. And from my knowledge of the human body, I understood that skin cells are made out of, protein, amino acids, and other, cellular blocks to build it. And I noticed that whenever I was eating, because I'm a very active individual, whenever I was eating in a calorie deficit, so what happened is that my body was like, hey, Mr. Sean's body, we need to put all the fuel and amino acids towards muscle growth, towards your skeletal system. The skin's going to have to be suffering a bit. And the second I made sure to eat in a calorie surplus every day and give my body some excess calories, it's like, okay, we can maintain your skin now. I made this theory up. I don't know if it's true, but it worked for me. Right. And it kind of agrees with science, just my simple understanding of the human body.
Right. Yeah. Well, I'll tell you what, if you could get rid of all doctors, Western, Eastern, you could probably get rid of all doctors.
Says the doctor.
Yeah, look, I want patients. I need to make a living like everybody else. But the main thing I want is for people to heal themselves. And if you poison yourself, it's going to have an effect on you. I think in this world there's no possibility of not getting poisoned along the way by the air, by the water, by the chemicals in our laundry detergent, and everything else. So you do the best you can. But paying attention to what affects your body and how it affects it, and trusting yourself is huge. I think that we have this culture of worship of experts, and it's good to hear what the experts have to say, but ultimately you live in your body, you live in your skin, and your body has the information if you can slow down and pay attention to it. And personally, I think diet is the number one thing. If people can eat good food and pay attention to what the triggers are, they mostly won't have to go to the doctor.
Well, I also feel that, being a patient, I want my doctor to lead by example. Like, if someone comes to me to be athletically trained, so I play tackle football, I play rugby with the dude in the gym right now, I train and consider myself an athlete, which is why I have the confidence in my abilities to train this person like an athlete. Mm-hmm. When I go into the clinic and I see a doctor who smokes, drinks, is overweight, and is not the epitome of a healthy human being, something about me is skeptical to trust him. I'm not saying that he doesn't know. It could be that he's the best doctor in the world and he's so knowledgeable, but it's skeptical to trust someone with my health if I see that he's unhealthy. I remember when we were chatting last time by take 1, you were saying that your Chinese doctor, correct, was also like a black belt in...
So what I was saying, my mentor and teacher is Dr. Alex Feng. He's in California. His place where he teaches martial arts and also does Chinese medicine is called the Zhidao Guan, the Taoist Center. It's on Broadway in Oakland. And so he was, I was 8 years old when I went in and started learning Kung Fu and Judo from him.
Oh yeah.
And now his Kung Fu and Judo students like me continue to teach in different places around the world, but his main focus is Tai Chi. So that's what he teaches now. But what I learned from him and what I've seen other places is that in traditional Chinese medicine, a Chinese doctor typically will do martial arts, and the Chinese traditional martial arts are different types of Kung Fu. Mm-hmm. And they usually do calligraphy. Chinese calligraphy requires great art and skill. Mm-hmm. I haven't learned it, but you have to be in a certain posture. Mm-hmm. You have to hold your wrist in a certain way. It takes a lot of sensitivity of the hand and wrist. They do music. They play at least one instrument. So that takes a lot of sensitivity of the ear, paying attention, like that. So if you're doing martial arts, which requires sensitivity of the body, and you're doing calligraphy, which requires sensitivity of the hand and wrist, and you're doing music, which requires a different kind of sensitivity, you're training yourself to pay attention, you're training yourself to listen.
I love it.
And you're also, because you're doing martial arts, you know what it feels like to live in your body, what injuries feel like. You're not going to do martial arts and not deal with injuries.
Wow.
So it's about training yourself sensitively, and in all the different ways. One of my teachers, when you do Chinese medicine, when you do acupuncture, you take a needle and you put it in somebody's body, and your own body hopefully too. You should do it on yourself so that you know what other people are experiencing. Anyway, this one teacher said, we have all these different quarters in America that have commemorative editions. The head's the same, but they have different different things for each state on the tail side. So you put a handful of these in your pocket, and you should feel them and get to where you're sensitive enough with your fingertips that you can feel and tell which state it is. You pull it out and you check.
I used to collect those quarters as a kid. I wonder if I could give that.
I didn't do that particular exercise,
Yeah.
but the point is that that's a lot of sensitivity. If you can feel, the idea is training the sensitivity, training yourself to pay attention.
I mean, that says a lot about a doctor. Like, if I'm ever a patient of a doctor, I want to see a doctor who lives my lifestyle, so he can help me. You know, wholesome approach. He has physical, he has spiritual, he has emotional, he has body awareness. And I think we also see the bridge a lot between the medical world and the athletic world, where I am, is that the doctor's approach is I want to fix his symptom, but me being the coach is I want to get him back to the field as possible, healthy. So a doctor will be like, immobilize, and, you know, ties back into it. I'll say mobilize. Quick, like, expert that I read from a book called JFK's Secret Doctor, if you ever read it. It's by a famous climber in the 1920s that he was like the father of modern mobility training. All the doctors were saying immobilize. He was like, no, let's try to restore the range of motion. So he would take skiers and snowboarders, or I guess snowboarding didn't exist then yet, into horrifying accidents. They would go to a doctor, and the doctor would say, you're never skiing again. So he would inject some sort of alcoholic serum into their muscle to numb the joint, and then he would move with them. And just by the act of restoring the range of motion, their recovery was accelerated by tons. So I take that approach with people. If someone's injured, my goal is to get them moving again. If I can get them moving again faster, everything's going to recover better, and that's my approach.
You just have to do the alcohol this way.
Well, that's a different type of alcohol. I don't know if I want to. I did have a guy come to my gym drunk. I wasn't happy, but I told him to go back home sober up. And
I'm just joking.
Yeah,
it's like acupuncturists, at least in the United States, we don't do injections. We're not allowed to.
Right,
inject.
I understand. Interesting. Okay, he wasn't an Eastern doctor, but he was a very open-minded Western doctor.
Right.
Anything.
Also, in the 1920s, who knows, the laws making.
Yeah, absolutely. But he was like, people were like, you're crazy. Like, and then he became JFK's doctor. JFK's Secret Doctor. Check it out. Anything else you want to add about the Eastern versus Western world before we delve on into another topic?
I will say one thing about both Western and Eastern. When I first started doing acupuncture, I went to a seminar that was actually about insurance billing. And the guy who teaches the seminar, he happens to be a chiropractor. And he said, I tell people the same thing about acupuncture that I tell them about chiropractic. Someone tells me, I went to a chiropractor and it didn't help. He says, you didn't try chiropractic, you tried chiropractor.
Nah.
Right? Not everybody practices the same.
I did one session, I didn't get results, bro.
Right. So the same thing, if you go to an acupuncturist, or you go to a chiropractor, or for that matter, you go to a general practitioner, and it's not working for you, it doesn't mean their style of medicine doesn't work. It means that might not be the right practitioner for you. It doesn't even mean they're no good. They might be perfect for your cousin. So sometimes you gotta look around.
Well, thanks for that. I definitely appreciate that. You know, every trainer, every coach has his own style, and I've turned down clients who said, "Hey, I'm sorry, I'm not a right fit for you. Here's another one I highly recommend. Specializes in X." Now we get to speak about a fun topic that's been on everyone's mind for quite a while. This past year and a half, 2 years, has been pretty difficult for the world as a whole due to the, coronavirus pandemic.
The what?
Exactly. the world, the virus that was recognized by the world as most of the world as the coronavirus pandemic. Are you familiar with this?
I've heard of it.
Heard of it? Okay. And I'm a movement and health practitioner. I'm not a doctor. I'm going to say it again because I'm not a medical, professional. But I work with the human body, and something was super sketchy about it. Everything I learned and understood from my years of experience was counterintuitive. I was being told, okay, from the age of 1, this is why I learned immunity. Correct me if I'm wrong. Immunity, the immune system is a beautiful system in your body that develops based on the organisms that it's exposed to. So, for example, my dog Charlie, he was born on a ranch, and he rolled around in goat shit for his whole, 3-month upbringing. So he's used to the ranch, which means he's not going to get sick from dog and goat poop. Is that correct? Not inherently?
In a nutshell.
Yeah, okay.
There's
so
of course much more to it than that.
Right,
yeah.
okay, so I'll get to
that. By the
that.
way, dogs almost never get sick. It's interesting to pay attention to.
They get sick after. Okay, quick divergent, but dogs that get human symptoms like ear infections and stuff that dogs should never get are usually dogs who have constantly get vaccinated again and again. And thank God dogs that don't. I'm talking about the rabies. Not a dog podcast. Let's keep dogs to a different episode. Back to the topic of immunity. So I understood that I build my immune system through exposing myself to sunshine, exposing myself to earth, which I'm doing right now, exercising, strength training to build up, my muscle and bone mass, and exposing myself to as many people as possible, as many environments as possible, as many textures as possible, eating nutrient-dense food, as well as preferably, if possible, organic food that doesn't have pesticides in it, minimizing plastic, minimizing, pollution and chemicals. I'll give you a chance in a second. Does that make sense? I'm speaking truth? Okay. What the government told me to do is stay inside, don't exercise, eat whatever you have, regardless of whether it's healthy or not. McDonald's is still open, but the gym is closed. And don't expose yourself to people because you might get them sick. So I was really confused, and I would love to hear clarity on that from Doctor, because I'm still confused.
Okay, so
dun dun dun, controversial.
Yeah, there's a lot there, and the basic way that the immune system works is that we're exposed to some sort of pathogen, some sort of agent that our body doesn't want inside of it, bacteria, viruses, mold, whatever it is, and we have various components of our immune system that recognize that thing and develop a specific reaction to it. Usually we get sick to some degree. I wouldn't say usually, because it's happening all the time. There are some cases where we get sick, and then once we develop the immunity, we don't get sick again if we come in contact with that same pathogen again.
Is that what a vaccine is, by the way, to an extent?
A vaccine attempts to create that artificially. So again, my 2 degrees are in Chinese medicine, but what I'm saying is not from Chinese medicine, it's from Western medicine. I'm not a Western doctor, but I know that what I'm saying is correct.
Hell yeah.
And you can look it up. Everybody should do their own research.
Absolutely.
Anyway, but there's an argument going on in some circles right now between the germ theory of diseases, which is saying that it's the specific bacterium or the specific virus that's the disease-causing factor. And then there's the other side of the argument that says it's because we're not keeping ourselves immune and we're not keeping ourselves healthy, that some sort of factor that's in the environment normally and that we come into contact with all the time and that normally doesn't make a healthy person sick is making us sick. So you go ahead and you find someone who's got the symptoms of what we call a flu, and you check them, and sure enough, there's an influenza virus there.
Right.
So one side says that virus caused the disease, and the other one says that person let himself get run down, and so he was susceptible to.
You mean he wasn't a healthy individual?
He wasn't healthy in one way or another, and so either he got sick, and that allowed the virus to invade and cause, and so you find it there, or his resistance got low enough that the virus got in and caused sickness. An example is staph infection on the skin. Everybody has staphylococcus bacteria on their skin all the time.
Is that the one that's resistant to antibiotics?
There is a
strain.
There's a strain of antibiotic-resistant staphylococcus. You mostly get it in the hospital.
MRSA?
MRSA is MRSA is Middle Eastern respiratory, I think. Anyway, there's these arguments there, and it's worth reading studies and looking at things, but at any given time there's a paradigm of thought, and it's if you've been raised and trained to think within a certain paradigm, it's very easy to see things within that paradigm, and it's very difficult to see things from outside of that paradigm. And the amount of evidence that you require to convince you that something is true is very little if it fits within your normal paradigm of thought. And you require an extremely large amount of information to convince you of something that's outside of your normal paradigm of thought. So in the Western world, we have been trained to believe that a virus can cause a disease. So the government says to you, there's this pandemic. Now, we've also been trained for the most part to trust and believe our governments.
Governments and medical system.
Yeah. And we have to look at why would somebody say something that's not true, or do they think it? Are they telling us something that is true? Are they telling us something that they know is not true, but they're trying to convince us that's true? Are they telling us something that's not true, but they think it's true? Like, there's all these possibilities, and you always have to think about the motives behind something, and you really can't know somebody else's motives unless they said it or leaked it in an email or something like that. And so it's so easy to fall into what are called conspiracy theories. I don't even like the term conspiracy theories at all, but it's easy to start thinking, well, the reason they're doing this is because this, that, and the other thing. Personally, I don't know. I have looked at a lot of studies, and I'm skeptical too. I wouldn't, if I knew somebody was sick, whether it was corona or whether it was the flu or whatever you want, and they got yellow snot coming out of their nose and they got a fever and they're shaking and coughing, and they take a sip of their water and say, here, you want to sip? I probably wouldn't sip out of their cup. I probably wouldn't choose to do that. On the other hand, I don't go around, during the popularity of alcohol hand sanitizers, which has been popular since my kids were born, my oldest kid is 22, I always told them to stay away from that stuff, because I think getting exposed to pathogens, mild pathogens all the time, helps to build up your immune system. And I saw a study that showed that on 2 farms that were very similar in America. One was a Mennonite farm, I think, where they used modern pesticides and other things, and the other one was a what do you call the folks who don't, a lot of them don't use tools?
Amish?
Yeah, the Amish farm, similar farm, and they tested the air. The air on the Amish farm had fecal matter and all kinds of dirt, and the other farm, it was much cleaner. None of the Amish kids had asthma. The other kids had a lot of asthma. So there's probably some truth to the idea that overly sterilizing your environment
100%.
Doesn't lead to good health. It actually has negative outcomes. But it's always really difficult to parse out what causes what, because there's no such thing as a controlled system where you can't find something else to attribute the thing to.
Wow, it's a lot of information for me to absorb. You can slow down the video, you can speed it up. I have 2 questions for you. Question number 1. Do you believe that someone with a healthy, strong, well-balanced lifestyle and immune system, when I say well-balanced, I don't just mean like a gym rat, because there's many gym rats who are unhealthy. Eats well, trains well, sleeps well, exposes himself to, stuff, poop, whatever. Do you believe that he shouldn't be suffering from harsh symptoms from corona? Like, corona exists. It's something out there, whatever it is. Do you believe that he should be getting harsh symptoms or spreading the virus?
Yeah, so you asked me if I believe, and I want to make really clear here, it's a question of belief, and it shouldn't be a question of belief. It should be a question of data.
Like, it should be a scientific question.
It should be a question of data, and the question is the data out there? Can you trust the data? And you got to do research, and you got to look at reputable research. And the thing is this: even when somebody tells you, for example, with corona, we have this percentage, we've been doing corona tests for X amount of time, and there's this percentage of infection. So I've been studying on PCR, polymer chain reaction testing. This is the test that they're using to determine if somebody has corona. Well, it turns out that PCR testing has something called a cycle rate. That means that they multiply the results of the test a certain number of cycles in order to determine the results.
Like a case study.
I mean like amplify. Like, let's say you can't hear a sound, and then there's a sound going on, right? Like a human being's range of hearing is between certain frequencies and not others. Like a little kid can hear higher pitched noises than I can, right? A rat can hear higher pitched noises than I can. So that you can amplify that sound to the point where I can hear it. Well, when they do PCR testing, apparently they pick up fragments of viruses or other things and they amplify it a certain number of times. I'm using the term amplify, but they run cycles. I'm not claiming to understand it perfectly. But when you run a certain number of cycles, eventually you can pick the thing up. So apparently in Israel they were doing 45 cycles. Apparently the CDC just said that more than 20 cycles is not trustworthy, which means something like 90% of the tests that have been done at 35 cycles, 40 cycles, 45 cycles. And it says on the CDC website, I checked this yesterday, it says that you can't compare results that were run at different cycles. What that means is, even if 45 is a reasonable rate, if you're looking at data that's talking about percentages of people who had a positive corona diagnosis, you may not even be talking about things you can compare, because 100 tests were run at this cycle, 3,000 were run at this cycle, 10,000 were run at this cycle. So what are we looking at? And if we don't understand the science behind it, it's very easy for anybody to tell us what they want and we believe it. On the other hand, if we understand part of the science, like I do, but not all the science, it's easy for somebody else who knows more science than I do to talk gobbledygook, and I'm going, wow, he sounds like he knows what he's talking about, it must be true. It's tricky. Where do you put your trust? So I would say, now going back to your question about belief.
Yeah.
I don't believe that most healthy people who don't have other concurrent problems are likely to get very sick from corona or from the flu or from anything else, and shouldn't be very likely to be getting other people sick. But I don't know that for sure.
Right.
And it is supposedly what they were saying at the beginning of this thing is that as opposed to the flu, which affects the very young and the very old, this was affecting the old and the not so old, but not the young. So I don't really know, but I also feel like the data is shifting and it's hard to get. I'll tell you with kids, for example, I'll finish with this. So if you look up on Google, which curates its results, it's not random results, but if you look on Google, how many children have died in the United States from corona under 18? You get all kinds of information without numbers. They say children are not as likely, but 8% of the deaths, It makes it sound like children are at risk. If you find a site that gives you the data, I think so far it's 257. 257 kids.
Wow.
More than that get hit by cars. So that's not a real risk.
Should do a car vaccine.
Right? That's not a real there you go. That's not a real risk. So are you gonna start and now they're really starting to move towards pushing to vaccinate children. Now, I'm not saying that this vaccine is extremely dangerous or extremely safe. That's a whole different question. But there is a risk to it. There are known risks to it. So would you take this vaccine with these known risks and give it to somebody who has no risk of the disease? The obvious answer is that's not a good idea. Medically, it's not a good idea. It might be a good idea financially for people who sell it.
Wow.
But people don't have the information. They don't know. Very few people know that only 257 kids have died in the U.S. from corona so far.
I think Google and the search engines control what we see. Facebook, Instagram, social media, they control what we see, and that was maybe part of the whole fear-mongering, part of the pandemic, is that we're only exposed to like this. We're not in a lab, hearing things from the scientists in the field. We're just listening to Google, and Google shows you the article.
By the way, I'm not sure this video won't have problems going up on YouTube because of this.
Ooh, we're speaking science. Ooh.
Well,
okay,
I'm pretty careful. I'm pretty careful to
keep it neutral,
to not be. I express my skepticism, but it doesn't. But I'm saying get the data. I'm not.
I've never expressed like facts on camera. I say my opinion. You're welcome to understand it as you like. You're welcome to comment below and tell us what you think. And if they want to say for Corona guidelines, visit who.com. Be my guest.
Right.
And we'll see what's up. Last question for the show, and you can speak about your homeostasis theory because I loved it. What do you do differently? You're the head of who? You're the prime minister, or you're in control of something. Right. How do you deal with the thingy that happened this past year?
Yeah, you can't put me in charge of the who.
Okay.
If I were in charge, I'd quit. I'm not the man for that job.
So can you give us your homeostasis theory?
Yeah,
I like it.
Yeah, I didn't use that term, but yeah.
That's how I understood it.
Right.
Is that?
So what I was saying last time is that
last time was the episode that didn't film. This is take 2. Yeah.
Yeah, like Google blanked it out.
Google's like, we're not letting this episode go up.
So yeah, that mint smells good. Yeah. So what I was saying is that that nature is always seeking a balance, and nature means everything. Nature doesn't just mean some sort of like hippy dippy thing. Nature is inside your body, outside your body. It's everything. And so if you look at animal populations in the world, they always have to get balanced. So if you have a very rainy season, a lot of grass grows. That allows the animals that eat the grass, like let's say rabbits. If rabbits eat grass,
we have a rabbit. They eat herbs, flowers, grass a little less. Leaves,
they like dandelions,
leaves, flowers.
But you have a rainy season and you have a lot of herbage. And there hasn't been much rain the last few years, so there haven't been many rabbits. So now there's lots of rabbit food, so the rabbits the population grows.
Mhm.
Well, the wolves eat the rabbits. In my imaginary scenario, I'm not trying to say that wolves' main food is rabbits. I'm
Mhm.
just making up a story.
Yeah, we have a pet rabbit, so it's okay.
Yeah,
no,
no
we like
wolf,
rabbits.
though.
We like rabbits.
So-
Well, we have a dog.
Right. Well, you probably don't let your dog eat your rabbit. So
He sometimes takes nibbles, but you know.
so anyway, so then because there's more rabbits, the wolf population grows.
Right.
Now what happens? Now there's a year or two of drought, so there's less green grass and other plants, so there are fewer rabbits because they have less food, and then that means that the wolves have less food, so then they have die-offs. Also, I didn't mention it last time, but all these things have social consequences. The rabbits are going to fight more. People think rabbits are peaceful. Rabbits fight like crazy.
Yeah. They tear each other's ears off.
Yeah,
literally.
they fight like crazy and they scream. Anyway, wolves also. If you don't have enough food, you're gonna have power struggles with the wolf pack.
Alpha males and
Right,
everything.
all that. So sometimes females lead the pack. So anyway, the idea is that you have to have a diet. So human beings, for the most part, for a long time now, we've been outside of that. Right? We through technology, we have more food, more distribution of food. We're less susceptible to our food only being. We don't only grow food when it rains. We have irrigation. We have greenhouses, so we don't only grow food in the green season. We have GMOs, genetically modified organisms, a different can of worms. But because of that, there's more wheat and more rice for some place. So there's people and there's medical cures and systems that have allowed an increase, a decrease in infant mortality, an increase in the number of people who live to adulthood. So we have supposedly something like 7.8 billion people on the planet Earth right now. Not that long ago, we only had millions.
Wow.
Right? And
So you're saying that like the advance of technology and medicine allowed a lot more population than it used to.
Exactly. And so what I'm saying is that where does that end? How many people can the planet support? And how does that work? And where does the balance happen? So in my mind, one of the things that causes that balance is die-offs. We had 6 million Jewish people and many other people killed just by Hitler in World War II. Many other people died in World War II. Stalin killed millions.
I think
and
20
millions
million
of people.
Russians or something.
Millions and millions of people have died for various reasons, warfare and other things. Now that's a tragedy. But had they not died and had they continued to have children, we'd have even more people right now. Right, if there was no flu pandemic in 1910,
the Black Plague,
the Spanish flu. Black Plague is going back to the Middle Ages, that same thing. Without all that, so I see all these die-offs as some sort of attempt for population control.
You're saying like a natural way to go about it to an extent.
Right.
I just want to clarify that because like, you know, both of us being Jewish, we both have fathers or grandfathers who were in the Holocaust. It's not that, God forbid, Hitler had to kill our grandparents.
No, I'm not saying...
I'm just like absorbing in it.
Yeah.
But someone, an evil person is going to come to power somewhere in the history. It's happened again and again, and be a bad person. That's what war is.
I'm not saying it has to be a person.
Right.
Let's say that the coronavirus is a totally natural phenomenon that arose. And we've got people like Bill Gates and Fauci and other people saying this is going to continue to happen. We saw the M1H1, which is early on was called the Mexican flu.
Yeah.
We've seen the MERS and we've seen SARS-1. Right? This is SARS-2, COVID-19. SARS is severe acute respiratory syndrome. So if it's true, where is this stuff coming from? What I'm saying, I'm not in favor of what I'm saying. I'm saying if there's not going to be mass die-offs, then there's going to be what? 7 billion, 10 billion, how many?
And are you saying, are you implying the world can't handle that, or it's going to like have severe repercussions?
What I'm saying, just as a thought experiment, is that no environment can handle continued growth of a population within it forever. Obviously, there have to be some limits. With the wolves, the limit might be how many wolves can live in a space, or how many rabbits are there for them to eat. With the rabbits, that might be how much grass is, or other greens are there for them. You know, there has to be some limit.
Wow.
That's all I'm saying.
Wow, I like that theory. I'm going to think about it, expound on it. I really appreciate you for sharing it to our viewers. Hopefully YouTube lets us publish this. And thank you so much for coming on the show. I know you did it in the intro, but you just want to give us a quick, you know, where your clinic is, how we can find you on social media or internet.
Okay, so you can find me under Dr. Aaron Leon Kenin, spelled Kenin on Facebook. You can go to www.leonkenin.com, LeonKenin.com. And if you just Google Leon Kenin or Aaron Leon Kenin Acupuncture, or if you use DuckDuckGo or some other engine, you don't have to use Google. You should be able to find me that way. Some of my references in California will come up, but I'm practicing in Gush Etzion, in Alon and in Jerusalem.
Sweet, dude. All right, you can step out of the bath, and I wanted to present you for the second time with this Sean Fit for Life, Strong and Functional, because who's more strong and functional than a doctor who has a healthy movement practice? So enjoy your second shirt.
Right
for
on.
coming out. Peace
on.
out. See you all next time. Thank you so much for watching this episode. You can find the rest of our content on our YouTube channel at Sean Fit for Life, right here. You can follow us on Instagram, right here, and you can comment and tell us your thoughts below. I'm Sean Fit for Life, and I need a bra.